students. I'm your presenter, Mr. Silwamba Collins. As for today, I want to present on nasogastric tube insertion. So nasogastric tube insertion, for the beginners who are just starting foundation in nursing, they have to learn about the tubes that we insert in the patient. Now, just by the way it sounds, nasal gastric tube insertion, meaning if you go to the word nasal is, we refer it as to nose, then gastric, it's the stomach, then insertion, to insert is to put, so it's as simple as it sounds. So nasal, which is nose, gastric, which is stomach, nasogastric tube insertion, so insertion is to put. So meaning, as a nurse, you're supposed to put this tube into the patient's stomach through the nose. So this procedure is very important because we put it in patients who cannot be able to feed by themselves, those patients who are unconscious, and premature infants. And then sometimes we use it because we want to aspirate gastric contents from the stomach. For example, if you have read about patients who have drank doom, which is an organophosphorus poison, so we need to aspirate. So we need to insert so that at least we decompress the stomach. So those are the indications. And then if you look at the tubes, there are different types of tubes. So as of today in this presentation, I'm going to show you a pediatric tube and an adult tube. So here with me are the samples. So this is an adult tube. It's as long as this much, as you can see. So this tube has got markings. Then we don't depend on the markings sometimes, so we need to follow the procedure of using a tape. So we're going to use strapping, which is here, so that we mark to say this is the length which will be inserted. So this is an adult tube, but we've got sizes. They range in sizes. Okay. Then we have a pediatric nasogastric tube, and pediatric nasogastric tube looks like this. But then if you look at the size, it's much smaller because pediatrics are small, so we need something smaller. Then this tube has no spigot, as you can see. It has no spigot, so meaning you have to just find something to occlude there. So it has no spigot. So you have to be mindful to check if a tube has got a spigot. But for this tube I have for an adult, it has a spigot. This is what we call a spigot. It's simply a stopper. So a spigot has to be put there so that air does not go in, or dirt or anything. So you have to close it up. So this is a spigot. So then let me introduce this trolley so that you understand it. So on this trolley, we have this receiver. This receiver, this we're going to discard used items. For example, if you've got gloves, used gloves or used swabs, we're going to discard here. So that's the use. Then we've got cool boiled water. So cool boiled water, we're going to use it for lubricating the nasogastric tube. So instead of using KY jelly, and in OSCE most of the times we ask for cool boiled water, we don't ask for KY jelly to lubricate the tube. So to lubricate the tube, we're going to use cool boiled water, which is here. And then this cool boiled water will move alongside with this gallipot. So in this gallipot, we're going to pour in a solution, which is cool boiled water for lubrication. So that's how they move. Then we've got strapping. Strapping will be used for marking the nasogastric tube, as well as for securing the tube on the cheek. Then we've got swabs here. These swabs are for cleaning the patient as they blow their nose, as well as for any other use in case any other need arises. Then we have a syringe. This syringe is a 10cc syringe. So this syringe is for testing if the nasogastric tube is in situ. So you're going to see as we do the procedure how we test. So I brought it here because mostly in OSCE this is what we want. Even in practice we want this to be simple as possible. We don't want to complicate matters. But there are other testing modes. You can test using other issues or other things or other instruments. You can use a stethoscope. So for testing if the NGT is in situ, you can use a stethoscope. But we said this is mostly for beginners and foundations. We're not going to use the stethoscope. And for us, please, we're going to use a syringe for testing, not a nasogastric tube. And then we've got other issues like we've got litmus paper. If you aspirate gastric content, you can test it on a litmus paper to check if it's inserted. Then here with me I brought dressed orange sticks. So orange sticks are used in case a patient is unconscious to clean the nostrils. So you're going to clean the nostrils just to ensure that it's clean and it's patent using an orange stick. Okay. So then here the only thing remaining are the gloves, because you need to be gloved up as you insert this tube. Then here again we've got an emesis ball. Emesis ball, this procedure, I'm sure as you practice, you'll be able to find out that this procedure, patients vomit. As you're trying to push in the tube, patients will vomit, so you need at least where they can vomit from. So this is an emesis ball. So you receive the vomiters as if in case they vomit. Then this is an incontinent sheet. I'm sure you know about an incontinent sheet. An incontinent sheet, we place it as we are inserting the tube. We put it there so that as we are inserting, in case of any fluids coming out, the clothes or linen has to be protected. Then alongside, in case you don't have a dressed incontinent sheet, you can go for a towel. A towel, just an ordinary towel. At home we have these towels. Anywhere you can find this one. So at least you can use any of what you find. So you can improvise. As you know, in nursing we always improvise, so you can always go for that. Okay. So I've introduced the trolley and all the equipment that I need. Then I have to also say we need the hand washing facility, because this is very, very important. Hand washing is vital. In any case, this is infection prevention. So to prevent infection in any procedure, you have to go for hand washing facility, meaning this has to be available. Okay, so after introduced the trolley and all the equipment, then we have to insert. So we have to visit, this is Mrs. Mwape. Though Mrs. Mwape has got a bald head, you know, but she's Mrs. Mwape. So the first thing that you do as the procedure, the first thing is for you to wash hands. Okay, so you need to go there, you wash hands, meaning you have to get on a soap there, then wash hands as usual. So there is a procedure for hand washing, which we demonstrated last week, just for hand washing, meaning you really need to hand wash. Then you come to Mrs. Mwape. So Mrs. Mwape, good afternoon. Mrs. Mwape has responded, she's fine. Okay, so Mrs. Mwape, I am Collins, come to insert an NG tube, which is a nasal gastric tube. This tube will be inserted through your nose to the stomach. Okay, so it will be a little bit uncomfortable, but then you'll be able to ensure that you're comfortable as we insert the tube. So as of now, we're going to at least ask you to sit up as we insert the tube. So that's the first important thing. After you greet, you introduce yourself, you even explain the procedure. Mrs. Mwape has to be asked to sit up. So this procedure accounts for, I can say for your marks accounts even on sitting. Okay, the patient has to sit up. So just to prop up the patient, that's a mark. So you just have to follow that one. Okay. So let's have Mrs. Mwape to keep going. So Mrs. Mwape, kindly sit up. So then Mrs. Mwape has to sit up. So then, since it's a dummy, let's try to prop up the dummy. Okay. So if you want to score marks in OSCE, you need to make the patient sit up. Even on the ward, if you're working, the patient at least who's able to sit has to sit up. Okay. So that you do this procedure nicely. Okay. So Mrs. Mwape is in a sitting up position. Okay. So at least that way. Okay, we're trying to maintain privacy with Mrs. Mwape there. Okay. So the next thing that we do before we strap is to make sure that we prepare strapping in advance, because we need a tape for marking. So we need to prepare strapping. So you can go that way, meaning this one will work as a tape. Okay. So we put it there. So my tape. Then the next thing is I need to prepare strapping for sticking the nasal gastric tube on the cheek. So I need to prepare it in advance. Okay, so you can prepare enough for sticking there. Okay, so it's prepared already. So then at this moment I need now to select which nostril. Which nostril is patent and where I can insert. So then this procedure, you need to know that the more patent nostril, that's the one you insert, not the other way around. So if you find out that the right nostril is more patent than the left, meaning you have to insert in the right nostril. If you find that if it's the left which is patent, meaning insert there. So for us to know that this nostril is patent or the other one is more patent, we need to do the following. Okay, so we need to glove up. We need to glove up. So this is a clean procedure. No need of getting worried to say it's a sterile one or something. Need to glove up. Then need to pour solution before you touch anything else. So label in your palm. Okay, so this is for lubricating the tube. Okay. Then you go to Mrs. Mwape. So you get gauze. You go to Mrs. Mwape, then you ask Mrs. Mwape to blow. So Mrs. Mwape, blow your nose. Okay. So Mrs. Mwape is blowing her nose. Okay. After having done that, then you need also to continue to test for patency. She has just blown her nose. So now let's see which nostril is more patent than the other. So what we're going to do is we're going to occlude one nostril at a time. So one nostril at a time, meaning this nostril this is the left nostril. So you need to occlude this. Okay? You occlude and then ask Mrs. Mwape to breathe. So Mrs. Mwape is breathing. Mrs. Mwape breathe. Okay? Mrs. Mwape is breathing and she's comfortable. Meaning this nostril, the right nostril is okay, it's patent. So let's test now the left nostril to see if it's patent as well. So we occlude also the right nostril. Mrs. Mwape breathe. Mrs. Mwape is breathing, meaning the left nostril is also patent. So at this moment, since both nostrils are I can say they're equally patent, we need to go for the left nostril. Okay, they are equally patent. So then, these gloves, if you see that they're dirty, after having done that, you can throw them, you can discard them. Okay. So now let's measure. That's another critical point. Okay, so these are some of the points that you should note for testing the nostrils. Okay, for making up the patient setup. Those are the points that will give you marks. And even when you're practicing on the ward, you need to do just that. It will help you. So let's now measure. That's the critical part for measuring the length of the nasogastric tube. So Mrs. Martin, I'm exposing this part to your chest so that I measure nicely the nasogastric tube that will be inserted. So you get the nasogastric tube. As we earlier on said, this is a spigot, so the spigot has to be there. So meaning the part that goes into the patient's stomach is this part. So you get this part has to go on the tip of the nose. So the nose has got this part here. So this is the tip of the nose, okay? So this is the tip. So that's why you take this part here, not where the spigot is, because this part will be outside the patient's body, this part here. But then let's look at this part which will be inserted into the stomach. So that's the one that goes on the tip of the nose. It goes like that. So this part has to be there on the tip of the nose. This is critical because if you don't measure it, meaning you won't know which part will go in. So let's go. Then it goes behind the earlobe like that. I'm sure you're taking note. From the tip of the nose, then goes behind the earlobe like that. Then you have to know your anatomy. If you know your anatomy, meaning from there it goes round up to the xiphoid process. So if you know your anatomy, you have to go tip of the nose, behind the ear, then up to the xiphoid process. So which is here. Okay. Now here you can see there's a mark, but here there's no mark. Okay. Here there's a mark, here there's no mark. So that's why it's important to get this strap here. You get a marker and put there. You strap it there so that you don't memorize where your mark is. No need to memorize, so just put it there. Meaning you won't be memorizing. Even if you put this tube back there, you'll be able to get back and get the tube instead of memorizing to say where did I mark or which parts did I measure. It's better just mark with a tape so that at least when getting, just get it like that. Okay, so then having done that, having marked, now we need to insert the tube. So before we insert the tube, now it's time to get an emesis bowl, because this patient might want to vomit and then we don't want to mess up the environment. Okay, we want them to vomit in this emesis bowl. So you can either put it here or somewhere close to the patient. So I would prefer it's here, so that if Mrs. Mark wants to vomit, I can simply give her this emesis bowl. So I'll put it there. Okay, so then at this moment I can even put an incontinence sheet and put it there so that I don't mess up the area or the linen. Then you go back to your tube, and this tube you have to put it in water there, the cool boiled water, just for lubrication. So just like that. Okay, so where you find KY jelly, you can use KY jelly, there's no problem. But where you find cool boiled water, you can use cool boiled water. But in an exam, I want you to use cool boiled water. So after having lubricated, you go to the patient. Okay, so Mrs. Mape, you should be swallowing. So you need to instruct Mrs. Mape to be swallowing as you push in the tube. Okay, so okay, Mrs. Mape, I've started. You need to swallow. Swallow. She has swallowed. Swallow. She has swallowed. As she's swallowing, I'm pushing. Swallow, just like that. Swallow, and I'm pushing. Swallow, and then you have to be fast, okay? Then as you reach the mark, you stop there. So that's the end part. That's the use of this mark. You end there. At this moment now, I need to test. Is this tube inserted? Is it in the stomach? So I need to get this 10cc syringe. So this 10cc syringe is going to be used there. So then I have to remove the spigot, but I have to occlude here. I have to kink it or occlude it, then remove the spigot. I can put it there, get this, then let go like that, then aspirate. So at this moment, if the tube is in situ, I have to see at least gastric content coming along this tube. If it's not there, meaning it won't show, it won't come. So meaning you're not there, you need to call for a second person to verify with you. Okay. Or if the patient is becoming restless, meaning they are failing to breathe, meaning you know that maybe it's in the airway, you need to remove it, or you call the second person to assess with you. But then if you find that the patient is restless, you have to just remove and try again. Okay. So another person can try to verify with you if you're not sure. Okay. So after having seen gastric content after aspirating like that, then gastric content is flowing back, then you have to at least occlude it. Then prepare for your feeds. So at this moment, you can prepare for your feeds. Okay. So you can thank Mrs. Mwape for having allowed you to do the procedure and then give appropriate IEC. So at this moment, you can choose according to the condition which IEC you're going to give, and then also try to tell Mrs. Mwape on the feeds that you're going to give. Then this can be secured this side because that's where it's easy. So you can give Mrs. Mwape IEC and you can try to emphasize on not pulling the tube. So like that. Then you can prepare for your feeds. Okay, so thank you very much for watching and hope you have a pleasant day. Thank you very much.